Pain isn't just about one joint, one injury, or one bad day. It's your body asking for attention, and the right guidance can change everything. Welcome to the Optimal Health Guide. I'm your host, Michael, and I'm here with Josh. Good to have you here on today's call.
Thanks, Michael.
Hey, so today what I'd love to be able to dig into is kind of some questions that people might have, especially if they're unexperienced coming to physical therapy. So I'll just jump in. I've got kind of three sets of questions again that I'd love to pick your brain on, and we'll go right at it. So how about this? Some misconceptions that people have about physical therapy. So when people hear physical therapy, what do they usually picture, and what's missing from that picture that they might have?
I think a lot of times people picture massage. For years, people would say, "Oh, you're a physical therapist. Your wife must get lots of massages." And I would kind of like, I don't know, get a little bit disturbed by that because, in so much schooling, massage, soft tissue mobilization is such a small percentage. So that was, I think, one big misconception. And I think another one is that it may just be a bunch of exercises. They're going to give me a bunch of exercises and then everything's going to be fine. That's not always the case. There's definitely more to it than that.
Yeah. Yeah, I hear you. And I think I might be a person like that would show up to the equation. I know I've worked with you guys for a while, so I think I understand a little bit more, having written blogs and stuff like that. But I think I would say stretching, exercises, and massage. So what's different? What would you say physical therapy is besides those things?
Okay, that's a good question. There's a lot of other components in handling a particular problem. For instance, sometimes joints aren't moving the way they're supposed to. And so we have to do some manual therapy exercise or joint mobilization to create that normal movement that a joint should have. Neurologically speaking, there are things that we can do to help nerves heal. And so that would be part of it. Also, we can use modalities like ultrasound, therapeutic ultrasound versus diagnostic
Yeah.
ultrasound, transcutaneous electrical nerve stimulation to help with pain, heat, ice, taping. There's a variety of
Yeah.
different modalities that we can also use as an adjunct to some of the other techniques and exercises and things that we do.
Yeah. Yeah. Okay. So now let's say you're applying those modalities, you're applying the heat and the cold, or you're using some of the technology that you're talking about. All of that is to help stop pain immediately or to help the body move in the right directions. How would you fill in the blank on that if I'm getting that wrong?
Well, I think one thing is first you got to figure out what the underlying cause of the problem is. Is it a tissue injury? Is it some biomechanical process of a joint that's not moving correctly? So once you've understood the particular problem that's going on, then you're going to attack what is needed. So example, perhaps a person comes in and they've got back pain and they're walking incorrectly, all cattywampus. Maybe they don't have enough range of motion in the ankle, and so that's causing, or hip, for instance, and that's causing altered mechanics in the way we're walking. Okay, so we
Yeah.
need to look at the hip, the ankle, evaluate that joint, create a normal movement in that joint by doing joint mobilization, by doing stretching, by doing whatever it is that we need to do to correct that, and then retrain the correct movement, and
Yeah.
then also deal with the weakness that may be underlying also.
Wow. Yeah. I see all of those different layers again coming right back down to discovering the root cause and then unpacking the rest of it. That's good. Well, let's say that somebody did have these kind of common misconceptions about physical therapy. How do you think that would limit somebody's recovery from what they could gain if that was the way that they showed up to the table?
If they had that kind of a perception, I think one thing is they may not decide to come. If I could just go Google search exercises for problem, in my shoulder,
Yeah.
then they may just go that route and be totally missing the other components, be it maybe it's an arthritic shoulder and certain exercises may not be appropriate for it. So knowing when not to do it as well. Sometimes people just kind of think no pain, no gain
Yeah.
is the way to go. And that oftentimes can actually make the problem worse. So kind of that assumption that they may have based on limited understanding of what is actually able to be done to
Yeah.
help a person improve their condition that they're dealing with.
Yeah. Okay, let's take that just a step further. Let's say that I kind of overcome that initial inhibition. I'm not just Google searching. Maybe it's because the pain is serious enough, like we've talked about before. And now I show up to my first appointment with you. I'm sitting there. You're probably unpacking with some questions. And let's say that I even tell you, like, yeah, I didn't even, I tried to avoid coming here. I was, Google searching and doing all that. Are there ways that you would even help me to kind of go from that? Because I would imagine I still have those misconceptions in my head and you need to unpack them. Do you think that walking through the steps that you would do of diagnosis and then care would make the difference? Or do you even try to approach it psychologically and help somebody if they said, hey, this is what I was thinking I was getting stepping into?
I think the first thing is asking lots of questions to really understand where they're at. If they're kind of not sure of what we can do, and I've seen plenty of people that tell me, I don't know that you're going to be able to help. Okay. So in that kind of a situation, well, why? Why do you think that we can't help you? And so kind of talking to them, finding out a little bit about what's going on psychologically. Maybe they've had therapy somewhere else and it didn't work. Maybe,
Yeah.
they did a bunch of research on the internet, they tried stuff that didn't work. Maybe they just don't understand what physical therapy can actually do. A
Yeah.
lot of different reasons. But I want to kind of get into the world and understand what their thought is. And then once I understand that, I want to begin to address it. So it may be through talking through what it is we're going to look at.
Uh-huh.
Maybe they're coming in with a shoulder issue. They've tried all this stuff. They've tried therapy and it hasn't worked. And we have a different approach sometimes. Okay.
Yeah.
Every therapist is a little bit different. And so I'm going to kind of unpack what I'm going to look at during the
Yeah.
evaluation, why I'm looking at it, and then try to build this picture for them by the time they leave so they
Yeah.
understand what the problem is, what we need to do to fix it. And it may be, exercise, it may be some stretching, but it also may be some other things too that they aren't aware of
Yeah.
to help restore that normal ability for that shoulder joint to move, to prevent pain, knowing also what not to do in that process so that by the time they leave, they're understanding it and maybe I've been able to give them a few things that they can begin doing also
Yeah.
at home.
That's great. I can totally see that guide side of what you're talking about and doing showing up and how you're addressing that. What about this? These two phrases, there might be just a slight nuance between the two of them, but what about treatment versus care? What's the difference between receiving treatment and actually being cared for?
Treatment, I think, is, you go, you have an intervention and you're done. Caring for somebody is different because I think with caring for somebody, you're spending some time listening to them. You're spending some time trying to hear what it is they're really after. It may be not that they have pain. It may be that they can't play with their grandkids or they can't go on vacation. They were
Yeah.
planning a trip to Europe and their knee hurts so bad they can't. So caring for them is bigger than just treating them. The treatment is part of it, but it's
Yeah.
hearing what they're saying, acknowledging that, recognizing that it's an important component to them, and
Yeah.
then walking through that and helping them understand how we're going to kind of deal with that issue so that they can get back to doing that. I think that that's the big difference.
Yeah, that's good. Again, I see the fingerprints of that, you know, the health guide that we're utilizing in our language here and how you've got somebody, a partnership that comes alongside of you. And I love that you're pulling out not just like, hey, we need to find out what the reason is, even, physically that's causing this pain, but like, what's your motivation for getting on the other side of it? That's great. That really kind of bookends nicely there. What about this? Why does like time and attention over the course of like, let's say multiple meetings matter so much in healing?
Well, there's a couple parts to that. One part is physiology. Time is important because there's physiological processes that happen when we change things for body to heal. So there's that component. Now, there's also the component of time being with a person to hear them, to understand them, to be able to develop rapport with them, and to be able to really hear what it is that's bugging them. That they have to be understood in order to be able to be effectively treating that situation.
Nice. That's good. Now, I'd imagine, again, not all physical therapy is the same. So, how does kind of a one size fits all approach fall short for most people? And really, how do you approach that differently?
With a one size fits all approach, it kind of reminds me of protocols. When I first started, we had a protocol for, this joint, this joint, this joint. The problem is everybody's different. Yes, maybe they have a knee problem and, person B has a knee problem, but they're different people. They have different medical histories. They have different needs. They have different fitness levels. They have different interests, and in trying to get a person to work with us, we have to be able to understand and get to know them well enough that we can kind of tailor what we're trying to do to be
Great.
interesting to them so they'll come alongside us and
Yeah.
work together as a team because we do want to work as a team in helping them through this journey.
Yeah.
So a protocol can't do that. A protocol is, I'm going to do exercise A, B, and C.
Yeah.
All right. We want to know an individual. I want to know what they're looking forward to being able to do. I want to know what they can't do. Maybe
Yeah.
functionally they can't walk a mile and they used to be able to, and they're looking forward to that trip to Europe. Okay. Versus somebody else that is just having issues going up and down stairs. Okay.
Yeah.
So having a different approach to treat those things. And it may also be that they need different kinds of exercises. They may need different kinds of modalities.
Yeah.
They may need different kinds of modifications to exercises because of other problems they have going on. They may have a back issue also. And so person A can do exercise A, B, and C, but person B can't do that because of these other things. So
Yeah.
that's where a protocol does not work and it breaks down. And you really got to just be able to do it individually according to what
Yeah.
that individual is, what's going to be best for that person.
Yeah, that's great. What I'm thinking of hearing you respond with all this is, all oftentimes respond on the back end to positive or reviews that come in, and the vast majority are positive. And I'm realizing, oh yeah, this is a common thread through many of those. People feel known, they feel cared for, they feel seen. And so I think all that individual versus, one size fits all shows up all over in the reviews that normally show up for Vance. So
One
what
other
about
thing I'd
this?
like to
Oh yeah, go
say,
ahead.
yeah, is, in treating people versus providing healing is I really like people to be part of our family. We really
Mm,
want to promote that family environment that you're part of our physical therapy family. You're not just a patient. You're here for life. You can call us at any point in time. I mean, that's caring for a person. If they have an issue, call me up. Let's hear what it is if something's going on.
Oh, that's great. That's a great dovetail into the section I want to dive into next. And so, kind of thinking along this, optimal health guide and the partnership that you're developing, the relationship that you're developing with people in healing and recovery. Why is it that recovery is more effective than when with partnership instead of something that you just do to the patient?
Well, when you're partners, you have active participation. You're working together. We can treat a problem easily,
Mm,
but in order to get maximum improvement, it takes more than just treating a joint or a
yeah,
problem. I've
yeah,
noticed that when a person is actively engaged with us, they're asking questions, they're really interested in what we're doing, working together, their outcome is better. Oftentimes, it's also faster. And most importantly, they're less likely to have it come back again
hmm,
because they fully understand how to manage it and prevent the condition from coming back.
yeah,
That's really where that partnership's really important so that we don't have that coming back and keeping getting in the way of their everyday life.
yeah. Yeah, I hear you. I think you're hinting at where I want to go next with this already because I can read it in between the lines. But then, what role does education play in helping people to heal well?
Yeah, education is very important. I think it's probably one of the most important things from a long term perspective in order to keep a person healthy and happy with their outcome. If we don't do education, we just treat this particular joint, it may get better and it may get better for the long term, but oftentimes it may get better for a period of time. Maybe they really needed education to understand, hey, this is a chronic condition. You're going to have to be dealing with it for a lifetime, but here's how you deal with it. Here's how you keep it under control. You do these things. If they don't get that education, they're not going to fully understand the condition and be able to handle it. In other situations, that education is really important so that they know what to do to handle it because it can totally go away and it can be
Mhm.
kept under control. But if they don't have those pieces of the puzzle of what it is they need to do, be it, hey, you need to put ice on this many times a day, you need
Yeah.
to do traction this time, so you got to do these exercises, you got to stretch every day, we got to do this joint mobilization, you can do this self traction, whatever it is. Once they have all that and they're good with it, that will really help as long as they fully understand what it is they need to be doing.
Oh, that's so good. Well, here's the last question we can dig into. And again, it's just going to fit like a domino right along what you're saying. How do you then help these patients kind of grow in confidence and not dependency? Because I think somebody could read Optimal Health Guide like, oh, you're locked in for life with this person. You're always going to need them, but you actually want to see them flourish even apart from you. So how do you grow people in confidence and not dependency?
I think that the dependence comes when they don't have control of the problem, when they expect
Ooh,
me to fix the problem, and I'm happy to fix it, but I don't want them to be dependent, always coming back for the same problem all the time.
yeah.
Maybe it's a different problem. Great. We'll love to see you and help you out with that.
Hmm.
But the confidence comes in understanding what's going on. When you have that understanding of what the problem is and what to do and how to do it, and you can manage it, now you're going to be confident in leaving from here and being able to take all these tools that we've provided you with to keep the situation under control and to prevent it from coming back. And if it does come back, what to do to prevent it. And of course, we're only a phone call away too if they needed something. But really, that confidence comes in when they fully understand what their program is, how to do it. And that's then when they really are able to flourish and
Yeah,
just take care of the situation on their own.
that's great. Well, Josh, you've given us a really good perspective on the hands-on care that you bring, the personalized care that you bring to people, even the vision of flourishing that you have in your mind and heart for everything that you're doing there. And so I hope this helps people kind of overcome some of those misconceptions we talked about at the top of the show and really come to find a guide to be able to experience optimal health. So thanks everybody for joining us today.